like to make this as interactive as possible for those of you who know me, so you will have to answer some questions and give some input. I'm just curious, does anybody know what Latinx stands for? Did anybody think it was a typo?
No, you better than that.
So it's actually gender neutral, Latino, Latina. Although I'm just used to saying Latino, so I'll probably use that throughout the presentation. So I'm so excited to see so many of you here today. Working with Latinos is very near and dear to me. I'm actually Portuguese, but I have spent most of my career working with Latinos, specifically children, women, and families who are immigrants, typically first and second generations. I have a bunch of handouts in the middle, and I'm happy to send you some links to some other resources that I've used, as well as the PowerPoint if you'd like, but there are some really useful handouts that we'll refer to in the center of the table if you haven't already picked that up. So, hola, bienvenidos. So I thought that was kind of fitting, right? So welcome. And I'd like to just start with a check-in. And doing the presentation, there were so many things where I was like, well, I think they should know that. And then I said to myself, I think that comes natural to me because I've spent so much time working with Latinos. So I really just want to gauge how many of you have worked with Latinos, where your experience level is. So have a little Likert scale. If we could just go around the room a little bit and tell me if you're at the 1, between the 1 and the 10. So very little experience working with Latinos, and 10 being lots of experience working with Latinos. So I just want to gauge kind of everyone's experiences with working with this population. So if we could just start with Jen. You just give me a number, kind of wake everybody up here.
I probably would say maybe like a 6.5. I'm on the higher end, but I wouldn't say that I have lots of experience.
Okay, great.
3.
3?
Mm-hmm.
5.
5.
Probably 3.
7. 7, good.
I'll go 3 too.
3? Excellent, we'll keep going through that. 5?
6.
6?
5.
5, okay. 3?
7 or 8.
Okay.
5, 7.
7?
3.
3?
Maybe 6.
6? Great.
Say about 4.
Okay. 8? Nice. 4. 4?
7.
7? Okay. And how about in the middle of the room?
6.
6? 6. 7.
Say about 7.
7?
7.5.
Okay, great. Well, thank you. And just curious, how many of you speak Spanish? Or do therapy in Spanish? Anybody? Just one?
I wish I spoke Spanish.
Okay. Some of our objectives for this morning, we're going to identify some of the relevant factors that impact Latino youth and families. So talk a little bit about the strategies to make counseling culturally sensitive to the values of Hispanic and Latino culture. And we're going to identify some interventions that are considered best practices for counseling. All right, so how many of you are always confused about which term to kind of use? That comes up a lot, right? So Hispanic or Latino, and typically there's no right or wrong answer. They're generic terms for people who are from Latin American origin or descent living in the U.S. And typically the term Hispanic is used by the U.S. government. Typically in our work we like to use the term Latino. And they represent people from Mexico, Central America, South America, and the Caribbean, many of whom descend from indigenous Indians and Africans, as well as people who have come from Spain and Portugal. Okay, so the U.S. Census Bureau indicates that people who identify with the terms Hispanic or Latino are those who classify themselves in one of the specific categories listed on the census questionnaire, as Mexican, Mexican-American, Chicano, Puerto Rican, Cuban, as well as those considered other Hispanic, Latino, or Spanish origin. So just to give you a little bit of a background, this is typically where many of the Latinos come from. As we indicated, we've got Mexico. In the Caribbean, we have Cuba, Haiti, Dominican Republic, and Puerto Rico. Guatemala, Honduras, Nicaragua, Panama, Costa Rica, and El Salvador. And then we have several countries in South America: Colombia, Ecuador, Peru, Bolivia, Chile, Venezuela, Paraguay, Uruguay, and Argentina. So what do we know about Latinos? Just want to open it up to the room here. What do we know about Latinos? What do you guys know in your work so far? What comes up? What's something that comes up for many of the Latino families that you've worked with? Yes.
The importance of family.
I'm sorry?
The importance of family.
The importance of family. Excellent. So tell me a little bit about that.
Like multi-generational, taking care of the younger kids and things like that.
Right. So engaging a number of family members, typically grandparents, aunts, uncles, etc. Good. What else?
Mistrust when it comes to mental health services.
Mistrust. Yeah. Could you talk a little bit more about
Yeah,
that?
so a lot of the Latino families I worked with, it took a longer time to build rapport just because maybe older generations thought that maybe they should seek advice from older family members or maybe church personnel, and so getting the family on board about like mental health services and what that consists of was difficult in the beginning.
Perfect. Great. Anything else? Yeah.
In a similar vein, like cultural clashes sometimes between older parents maybe from more rural areas or just more conservative areas versus people that were born or mostly raised in America.
So different ideas, traditions, right? Expectations. Okay. Great. Yes.
There's a big problem with language because oftentimes the parents don't speak any English at all.
Absolutely. Absolutely. And we'll talk a little bit more about that and how that really shifts things when they come here, and they really rely a lot on their children. So we have really parentified children who are doing lots of translation for the parents. Right? So, have any of you ever been to or lived in a country where you didn't speak the language? Yeah. Could you tell me a little bit about that?
Oh, I mean, one time I vacationed in Mexico.
Okay. Were there enough people who spoke English?
Huh?
Were there enough people who spoke
Yeah,
English?
it was on a resort.
Okay. So anybody have an experience where they felt a little lost or they couldn't communicate? Yes. Tell me a little bit about that.
So I studied abroad in Spain for 6 months during college.
Okay.
I speak some Spanish and was studying it there. However, I do not speak Catalan at all, which is like a weird.
Yeah.
And the language, it's a bastardization of French and Spanish together.
Sure.
And a lot of like the official stuff was in Catalan, and I had no idea what they were talking about.
I actually spent a lot of time in Spain and am fluent in Spanish and could not understand what they were saying. So it did seem like a foreign language. But you spoke some of the language,
So, yeah,
enough to get by, right?
Yeah.
Okay. Anybody have a different experience? Yes, Stacey?
Not a Latin country, but France.
Okay.
I went, and I had no idea what they were speaking, and all of the signs there. Like even sometimes I notice here we have signs in English, and they might be in another language. In Paris, it's all in French. So it was very hard to navigate. Luckily, my fiance speaks Creole, so he was able to, do some of the translations and sort of help me out a little bit. But it was tough.
Sure.
Yeah.
Tough to figure out your basic needs, right? Yeah.
Although I didn't live in another country, I visited Iceland,
Oh.
and that was a place where the language was so, like even the letters in the language were so foreign that you couldn't even read signs and figure out how to pronounce things or look things up or understand anything anyone was saying ever.
And how long did you have that experience
It was for about a week.
A week.
It was actually very exhausting in a way because everywhere you went, you were like, I don't know what that means. I don't know what you're telling me. I'm not sure. I don't understand the directions you gave me. It was a really interesting adventure.
Sure. Yes.
What I was going to say is that I've been to a number of countries where English isn't spoken or the kind of Spanish I know isn't spoken, what little Spanish I do know. And I think to answer one of your questions is that, when I'm in those situations for a number of days, I have this sense of myself, whereas maybe normally I think I'm a fairly intelligent person who can talk to people and relate to people. You start to internalize this sense that, I'm kind of an idiot because of the way people are looking at me. I don't feel intelligent and I don't feel like I can relate to other human beings. And there's this fairly quickly after just a number of days, I feel this sense myself.
So what do you think that's like for, oh, I'm sorry.
No, that's fine.
Go ahead.
No,
Go ahead.
Well, I lived in Israel for a couple of years.
Okay.
So you're talking about a place that has so many like cultural and linguistic factors in it. It was really complicated just to get from point A to point B and to communicate any kind of basic needs. And I agree with you, Jeff. I think that was really one of the things that I noticed first and foremost was the fact that like, wow, I sound stupid. Like all I can say are these 5 words because I really didn't know the language until I was there long enough to be able to pick something up, to be able to really get across what it is that I needed. So I think that there was this automatic otherness that you feel in that kind of culture that can be really problematic in terms of really being able to assert your needs, and that tendency to kind of go back to what's comfortable for you in order to be able to get some basic needs met.
Thank you for that.
So what do you think that's like for families who are living here for months or have, no opportunity to go back? In all of your experiences, it was short-lived, and you got to come back and be in your safe place where you know the language and you know the system and you know how to get by. But what do you think that might be like for families who don't have that opportunity to go back? What are some issues that come up?
I mean, kind of playing off what he said, that kind of like the internalization of stupidity. Like these parents, a lot of whom don't have education, definitely would have a tough time picking up the language. They might internalize a lot of these feelings of stupidity and just kind of own that, and then just learn to stay in their safe spaces as long as they have some people that can kind of make them feel comfortable. So maybe like it's something like a problem at the 2-month mark just becomes something that they kind of roll with just because they don't have enough confidence to like learn more.
Even trying to understand our transportation system, our educational system. I mean, these are some really complex things that they have to navigate that are entirely different from the systems that are in place in their native country.
And building a sense of trust in someone that you don't know, or strangers, or whoever that may be.
Sure. And so I want to stay with that for a little bit, because another issue that's critical is, the trust in that you're afraid to leave your house sometimes because you're undocumented, right? So there's this tremendous fear that keeps people in their homes because they're afraid of the police, they're afraid of somebody reporting them, so they really live in this constant state of fear. And we'll talk a little bit about some of the cases that come up, but in working with a lot of the women who are in abusive relationships, they fear calling the police when the situation gets so bad because they don't want to be deported, they don't want their husband to be deported, they don't want anything to happen to their children, so there's just tremendous fear. So really, there's a real need to help educate them about the system, and that not everyone is out there to get them, and that there are people who are willing to help them. So great. Anything else? Yes, Jeff.
Well, just something you said earlier made me think of, what a number of us had mentioned about the feelings of being of incompetency or whatever it might be, but when you have to then depend on your maybe 11-year-old child,
Right.
You become dependent on your child to communicate with people. How does that compound that sense?
Absolutely. And another thing, a lot of my work has been in schools is this assumption, and talking about what are some of our assumptions that a parent doesn't care because they don't show up at back to school night or to parent-teacher conferences, or that the homework is not done, or the child comes to school without their folder because the parent doesn't understand and isn't even able to read. Just a quick story. I was with my mother over the weekend who works, she's a kindergarten teacher in a school where it's probably 90% Latino. And she just had this new boy come into her class from Nicaragua who has not been in school ever. So this is his first experience in school in America. He left his mom and came here with his dad. It took him 2 months to get here. 5-year-old, took 2 months to get here. His father has to work day and night. But in trying to get this kid enrolled into school, there was this major barrier because the father couldn't even sign his name. so he didn't know how to sign his name. So, the secretary, she was telling me the story about the secretary. He's like, you just have to sign here. And he's looking at her like, and she's getting frustrated, like, just sign here. And this whole interaction was going back and forth. And then finally somebody asked the man in Spanish, do you know how to write? And he said no. So think about the embarrassment of a parent coming in to enroll their child in school and not even being able to fill out any of the paperwork or even sign their name. So sometimes you just really need to be aware of that and find some ways to ask these kinds of questions in a way that's not going to shame them.
And not knowing what you're signing, too.
Right. Exactly, yeah. So other assumptions that we make about Latinos? Yes.
That all of them know how to speak Spanish.
That all of them what?
Know how to speak
Know
Spanish.
how to speak Spanish,
Yeah.
okay, true. So sometimes you meet a Latino and they don't know how to speak Spanish. Others? Yeah.
I think sometimes for like our easy, like you'll say something and to somebody in English and you just kind of assume that they understand it, because people will like, nah, okay, I got it, but like don't really understand what you're saying.
And does talking slower or louder help? There's a tendency for people to do that and speak very, very slowly. It's not going to help, right? You either know the word or you don't. Any other assumptions that we make?
Sometimes it's the opposite. Sometimes, like when you're dealing with a kid and they come with their parent, make the assumption that the parent isn't going to speak any English, and you kind of have that, like, if you've had a long day, that might get frustrating, like thinking that I have to use the language line again, so that's an assumption that you can make.
Yeah. That's a good point. Anybody ever have to use a language line to tell a parent that their child is suicidal? I mean, talk about really impersonal. Having to use the phone to explain this to a family. So definitely difficult situation. But great, these are some great points. Any others? Any other assumptions?
Just like Hispanic people, like a certain look or certain complexion.
Automatically assuming that they're okay. Good. Did you have something, Julie?
I was just going to share a quick story that I had a student in the school-based program that had to meet with a psychiatrist last Wednesday, and he's in the care of his great-grandparents, and the psychiatrist was getting really frustrated as well as the great-grandfather trying to answer certain questions, and then the great-grandson came in and he knew more of the answers, and I think that was really embarrassing to the great-grandfather, and then I think the psychiatrist ultimately felt bad as well, but he had a much better understanding of his condition even as a middle school child as opposed to the people who have been caring for him since birth.
Sure. Do you have any ideas about what other factors might have been contributing to that?
I think just the lack of the knowledge of the mental health and the different diagnoses and stuff, and not knowing, maybe not always asking questions. They didn't know why he was taking a lot of the medications that he was taking, and I think verbalizing that in a room full of strangers was it seemed to be very shameful and embarrassing for him.
Sure. Thank you for sharing. Did you have
Yeah, I was just going to say another assumption would be that if they speak enough English that they would want to speak to you in English.
Sure.
I've seen on the inpatient unit people say would you prefer we use the language line, whereas if they can speak enough, we usually want to get by and don't want to offer language.
Have you asked that question to parents and have them want to use the language line?
Yeah.
Great. I think it's great that we have that ability to certainly use the language line, but it is definitely not the same as having someone directly speak in Spanish or whatever language they speak. Great. Any other final thoughts? So I just want to read a quote. It is problematic to try to describe an entire cultural group because it may create or reinforce stereotypes. We must remember that even though Latinos share many characteristics, the terms Latino and Hispanic stand for a large and varied group of individuals. Countries and regions have different languages and dialects and are often ethnically and racially diverse. So again, being very cautious to not just lump them into the same group. And Maribel's shaking her head, so I'm gonna have you add to that because I know you understand this as a Latina. But tell me why this is crucial.
The first question is always, and where are you from? And were you born here or over in Puerto Rico? Oh, you look whatever they think I may look like. So I guess just knowing how they're gonna view me as being Puerto Rican compared to wherever they come from, and the stereotypes that they have about me.
And so, and would you say that there are significant differences from someone from Puerto Rico versus Dominican
Yeah.
Republic, or
Absolutely.
Or Bolivia or Argentina?
I mean, I think there's some. I just think the stereotypes are deep. So, knowing that.
Sure. And so I'm going to stay with this for a minute with an assumption about Puerto Ricans, because they are U.S. citizens. So often there's this belief that they're a little bit more privileged, right?
Yes.
Any other thoughts? Thank you for allowing me to pick on you. So why should we learn about the Latino population and immigrants specifically? Why is this important? Why did you all show up this morning? You didn't want to be in your offices?
That would be fun.
What do you think?
I mean, I think for us, in the inpatient units, for example, we see a wide variety of people from different cultural backgrounds, and we see a significant number of Latino people, youth particularly, who have complicated family scenarios related to immigration. And we've seen, I think, one of the configurations we see a lot is a separation between a child and parent. Maybe a child and a mother, for example, so the child was raised by relatives in their country of origin, and then comes to live with a parent here in the U.S. when they're 12, 13, 14, and those are usually very challenging times. And even the assumption about Latino people speaking Spanish or speaking English, sometimes in those situations we've had in other situations we've had kids that don't even speak the same language as their parents. So we're using a language line to communicate for the benefit of everybody. So that's something that we've been doing a lot of.
Absolutely, and I think there are several challenges that arise in that many times you will have an adolescent who purposely wants to speak English. There's this power struggle with the parent, right? I'm not going to speak Spanish, you left me. And so there's a lot of animosity over the parent leaving the child back in their homeland, and then this expectation that the child is now going to listen to everything that they say when they haven't had that parent role in their life for 10 years. So I think there's a lot of dynamics that come into play. Sure. Anything else?
I was just saying, I have a student that comes to mind who his family's from Peru, and he's taking Spanish in high school, and he doesn't understand it very well. He's really struggling, and it's very different from what he speaks or understands at home, and that's really a challenge for him right now.
And there's probably an assumption that he's going to be best in the class because he is from Peru. Sure. Did somebody else have to?
Yeah. Just generally speaking, by 2050, Latino population is going to be like the majority of the people in the U.S. So my graduate research looks at students of color getting their PhDs in psychology, and one of the things that I always advocate for is that these people these diverse people are not being seen in graduate programs. So by 2050, we'll have most of the school-based population, most of
There you go.
being diverse, but you don't see these people pursuing the degrees just because of the stereotypes, the roadblocks, systemic. The list goes on and on. You just don't see these people in graduate school.
Sure.
Which is a problem. So.
Sure. So that you're absolutely right. I mean, look, the numbers are staggering. With the rise in the Latino population in the U.S. projected for 2050, it's definitely impressive. So just to go over a little bit of statistics, because I think that this brings value to why we really need to learn about the Latino population and how to work with them, because we're going to start seeing them, I think, even more so than we are now in our offices. So predominantly Mexicans seem to take on the higher rate at 63% for the U.S. as the largest group. followed by Puerto Ricans and Cubanos. So just wanted to share that. I thought that this was relevant because of all of the issues that come up in our work with children living below the poverty threshold and the issues that come up for that. So really just looking at the staggering numbers. This separates it by first generation, second generation, and then your non-immigrant Latinos. So this is something I'm really interested in, and in my work with Latinos, I always want to know about their story. We'll talk a little bit about that, but how they got here. And I'm always amazed at these young kids kind of crossing the border by themselves. And we'll watch a little clip later on about a 9-year-old who is migrating here on his own, but I mean, this is it's unbelievable that kids are coming here on their own, typically without a parent. Sometimes they come with a family member, sometimes it's somebody they know in their, in their pueblo, but typically they're not coming here with a family member. And I couldn't find anything more recent. This is from 2013, but I would expect that these numbers are even greater at this point. Any thoughts on this?
I just appreciate that you're, talking about the immigration experience for people, because that's something that I found really stunning in a way.
Sure.
Working, with people in our inpatient service, the varied ways that people come here and dangerous.
Sure, absolutely. And I think that is really critical to treating someone, that you really need to find out how they got here. There's so much that comes out of that experience, whether it was traumatic, did they go an extensive amount of time without food or water? I mean, sometimes, I've heard, I had a 16-year-old I was working with who went 3 days with only water and not knowing when he was going to make it to his next stop, so basically they're constantly paying these people to move them from one location to the next, but there's very little information that's given to them. So they don't really know how long they're going to be until it's time to get in the van or a freight train to get to their next location. So these are really important things to ask about. So how does this impact our work? We've been talking a little bit about that. So given these experiences, they are at risk for significant mental health issues. Many of them are, having their traumatic journey to the U.S. on top of getting here and then being exposed to, harsh conditions, unsafe neighborhoods, limited resources, overemployment. I sometimes can't believe how little people are working. How much people are working, because they have multiple jobs to make ends meet, and they hardly see their kids. We have a family the really sad situation in Carteret, where the mother is a single mother, Latina, who is working 2 jobs. She can't afford childcare, so she left her 10 and 11-year-old at home while she was in between jobs, and then a neighbor called DCP&P and the children were removed. And it's so, obviously we want the children to be safe, but at the same time, what are her options, right? So she is really struggling financially. She's got 2 boys, she's a single mom, she doesn't have any family here. And, paying a babysitter is what she's making per hour, if not more sometimes, I know I pay my babysitter $15 an hour, and typically they're making a lot less than that. So it's really a challenge. So what do you do when you need to work, 2 jobs? So really being empathic to these situations and really needing to brainstorm around how you can work with the family, given the struggles that the mother has, or that the family has. So I talked a lot about this traumatic journey to the U.S. Have any of you heard stories from clients about their journey here? Anybody else? I see a couple people nodding. What do you think is a typical length of time it takes most people to make it to their destination? Any ideas?
Usually it's more than once that they have to do it. That, in my experience.
Sure.
And it takes months. And a lot of planning behind the scenes.
Yeah.
But it's not only their journey on how they got here. I also find it important to ask how they became legal citizens if they are.
Right.
Because the thing that women will do to get papers is extreme. And now we have youth who know that their social security numbers are not real, trying to get loans.
Sure.
And that's also something that I think we need to discuss with our kids that we're servicing.
Sure. So you're absolutely right. Typically about 2 to 3 months. The other part of that is the expenses. So it's about anywhere from $5,000 to $10,000 to pay for someone to make it over here, and there's no guarantee that they're going to get here. And there's no communication with the family, so the family never knows, when they're going to get here, how long it's going to take them. So you've got the major financial burden. Think about how much it takes one or two people who are already here sending their money back, $5,000 to $10,000, so another family member can make it here. And you bring up an important point. So sometimes they've had to make this journey more than once because they get stopped somewhere and then they're taken back. So that's really important to know is how long this journey was for them and what happened along that journey. So some of the core cultural values across Latino communities. We want to talk about how it varies by country of origin. We've talked a little bit about that, but really recognizing that things are different depending on the region that they're from, looking at their religion, and then looking at some of their protective factors. So we're going to talk a little bit about some of these 4 factors. Familismo, collectivismo, respeto, and personalismo. Have you guys heard of that before? Yes, no? Couple people? Okay, so the first one we've talked about so far is just the impact of the family. And so the Latino family has been known as the great untapped resource, right? So they look to their family members for everything, for all their support. Many times someone, if they don't have any family here, their greatest support will just be calling their family member back in their country. So they're more likely to do that on a regular basis than they are to go see a counselor. And so family is really, really important. So in our work, you really want to include family members. Caring for relatives is important, and they really place family needs above individual needs. So that is a tremendous value. I talked about it as a protective factor, but it can also be a risk factor. So where there's instability and dysfunction in the family, familismo may serve as a risk factor that draws some of our youth to delinquent groups such as gangs, given that they serve as a surrogate family. So while family is important, if they're here without their family as a young adolescent, there's a likelihood that they may seek out gangs to feel like they're part of the group, part of something. And the next one is collectivismo. And this is a concept in which the family extends their view of community. So they really look at what their role is in their community, and they seek out community members for support. So Latino communities are very tight-knit. There's an drastic importance on neighbors, or called vecinos. And there's this concept of tíos y tías. Anybody know about that? Tíos y tías? Everybody's an aunt or uncle. So tío is uncle or tía. So even though they're not blood relatives, if they're a family friend, that's my tía. That's me, So just kind of understanding that. So when a child says, my aunt, it may not be a blood relative, but it's somebody who's seen as a family support. And the next one is respect. So there's a tremendous amount of respect for authority figures, elders. So typically, children are taught that they have to listen to their elders. Their elders know best. They are, seen as, the idols in the family. So there's a tremendous amount of pressure on children to really listen to their elders. And this can create some conflict sometimes, right? We talked briefly about this before, but this concept of role reversal. So there's a real issue that comes into play here because in Latino families, the elders are really highly respected. However, if you're here and you don't speak English and you don't know how to pay your bills and you don't know how to write a check and you're relying on your child to do all of these things for you, it really shifts things. So you're really playing with one of their core values, and that creates a lot of tension in the family. Anyone have this experience or have any thoughts on this?
Well, not exactly related to that, but we talked before about sort of the mistrust of the medical community that can happen.
Sure.
Also, based upon largely this principle, you have parents who come in and you can basically tell them anything.
Mm-hmm.
Like you're going to do like just any medication, like okay, and they'll just agree with you to anything you suggest. And it's almost a little disconcerting when you're like, no, I want some of your input and feedback. Like it's supposed to be like a conversation discussion. They're just like, no, whatever you want, we'll do.
Mm-hmm. What do you think that's about?
I mean, it's multifactorial probably.
Yeah.
There's part of this where it's like sort of you are the authority figure,
Sure.
you are the expert, so what you say goes. Part of also just not like, I think we talked about sort of feeling kind of like either inferior or stupid or not intelligent enough to be able to engage in the conversation, just being okay, I don't know anything you're doing.
Absolutely, right. So not even knowing the questions to ask or what to say, so that they don't feel stupid. So they're just kind of yesing you to death, and that that's problematic sometimes because they're not engaging in the treatment and they're really just agreeing with whatever is being said. Any other thoughts?
I've also seen school personnel try to use like the immigrant status as a way to bully parents, which is very disconcerting as well. So for example, maybe a student they're saying that needs to be in like special education, but really that's not the case. It's really just that they're not fluent in the language you're testing them in.
Right.
And so once again, the parents seeing the school personnel as an authority figure, just saying, okay, well they must know, and us really have to step in and be an advocate and say no, and it's okay to say no, it's okay to ask questions, especially if school personnel is using a lot of jargon and things that they don't understand, especially if they're new to the country and the educational system.
Absolutely. That's a really important point. I'll get right back to you. And this is something that actually really frustrates me in schools, is this automatic need to refer to child study team. Sometimes without even asking any questions. You have a conversation, you find out the kid hasn't been in school for months because of all these transitions in their home or because they had to work at the age of 11. And so it doesn't necessarily mean they have a learning disability, it just means that they've missed so much education, or even that it's not comparable, right? So the grade level is certainly not comparable here as it is, where they're from. Interestingly, we do work in Perth Amboy, and Perth Amboy has finally started they created a program specifically for kids who have lost time in education. So they're not classifying these kids. They're enrolling them in this program, and it's filled, obviously, because they have such an influx of immigrants coming in. But it's great that they finally moved on this, and I wish more school districts would head in this direction, because there's this overclassification of kids when it's not necessarily a identified learning disability, it's just that there has been a lack of exposure to the public school system. Jen, and you had a...
No, I wanted
comment.
to speak to that point,
Sure.
actually. I mean, that's almost sometimes your best case scenario, is referral to a child study team, being able to engage in the dialogue about what has happened, what's been the disruption in the educational process, and what might be the underlying issues. Because it's almost worse when oftentimes these kids will fall through the cracks, and nobody will flag that there's anything wrong until there's a behavioral disruption, right? And that's what we end up seeing is that then the kids get referred into the system for all of the externalizing behaviors, when really it's that they've been frustrated because they've been underserviced in terms of their educational opportunities.
Absolutely,
right?
that's a great point. The other thing that we'll see a lot is just them skipping school.
Right.
Or not showing up to school. So in Perth Amboy specifically, I can speak to that just because we're in there, we have a program there, is that we're seeing a number of kids just not showing up to school because they're misplaced, they don't know what's going on in the classroom, and so it really takes them a long time to kind of figure out how to meet all of their needs. So I'm bringing this up because I really want you as clinicians to think about how you can advocate for your children that you work with, when it comes to the educational system. So sometimes they don't even think outside the box. I hate to say that, but it's really just what other supports can we put into place for this child as opposed to just referring them to child study team. Understandably, there are significant resources that they can receive when they are referred, but what are some of the other things that could be done to help support this child? Great. Did you have a comment, Susan?
I was just going to say one thing that we've been able to do in Edison is they were very quick to just fail these kids. So they put them in the classes, they fail, which of course affects their self-esteem and truancy.
Sure.
So they were, at least in Edison High School, they've kind of shifted it more to a pass-fail system and then trying to incorporate more of their academic classes in ESL. So that's been a little bit more helpful. Not a perfect fix, but at least it's in the right direction.
Absolutely. Great. Great. Any other thoughts? Okay, so one of the issues that arises specifically with teenagers and this conflict with parents, with this notion of respect, is that parents are typically, or grandparents are very traditional in their thinking, and that what I say goes, and this is what's best for you. So the children often feel that there is no respect for their ideas, their contributions, their worth. So they really feel like there's this lack of understanding, and they'll often say, well, my parents don't understand me. I mean, most teenagers say that, but specifically in Latino communities where they don't stop to listen. There's really a lack of I guess, time spent on communicating with their child and what they need and how things are different here. Any thoughts on that? All right, so the next one is personalismo, and this is that the Latino culture places tremendous value on interpersonal relationships, typically considering them more important than status or even material gain. So again, it's not about what you have or how much money you have or what car you drive, but and who you know and who you can gather around with, who you can get together with on the weekends. So there's this tremendous need for socialization, for feeling like they're connected to communities and to people in their social group. So typically they will seek out, we've talked about this before, they will seek out support from people that they know, and this often prevents them from seeking professional care from institutions, from hospitals, from community mental health centers. So we'll talk a little bit about some of the cultural considerations, and we've touched on some of these so far. We have varying levels of Spanish language usage. We have different cultural traditions and values that need to be considered, perceived in actual patterns of discrimination. We haven't talked much about that, but that is something that comes up specifically in schools. There's a tendency for people who don't understand Latino cultures to refer to everybody as Mexican, right? So, oh, he's Mexican, he's dark-skinned, he's Mexican, and not really understanding where they're from. And so there's this feeling of not being respected or understood. Have you guys encountered that as well? So another thing to take into consideration is the level of cultural integration or biculturalism. So how do they identify with the mainstream culture, and are they connected to their roots in some way, even though they're here. So you want to take all of that into consideration. Acculturation, I think that most of you know what that means, but it includes a change in cultural patterns of one or both groups. So how do we acculturate into the mainstream culture? How do we merge the two? It's a process that's reliant upon social interaction. It's indicated by a variety of factors, some of which include ethnic identity, language use, proficiency, nativity status, and culturally related behavioral preferences. So other considerations. Clinicians must be aware of relevant contextual information that stems from a patient's culture, race, ethnicity, religion, or geographical origin. So I have this example up here. Uncontrollable crying and headaches can be symptoms of panic attacks in some cultures, while difficulty breathing may be the primary symptom in other cultures. So really, really asking a lot of questions about the symptoms that they're feeling to ensure that you're getting the most accurate information. Other things to consider, things such as eye contact, body language, open-ended questioning. Dr. Clark talked a little bit about working with families where they just kind of yes him. So sometimes if you ask an open-ended question, that might be intimidating to a parent or a family if they don't have the language to use to really explain that. So you may have to dig a little bit deeper and change your line of questioning if you feel like you're not getting the answers that you need. So we talked about acculturation stress and economic issues that also tend to be very prevalent among these individuals. For families who are from one culture but live in an environment where an alternate culture is dominant, the differences between the two cultures can create lots of cultural tensions. In particular, as they feel conflicted with the demands or expectations of both cultures. That can be very, very challenging. I worked with a young lady in New Brunswick several years ago who her family was adamant about her wearing skirts. She had to wear skirts, and she just she could not wear any shorts. She couldn't wear any pants, and this was a huge issue for Jim because there was this expectation that she had to change for Jim, and there was this shame in bringing this up to the teacher. So she was failing gym class because her parents wouldn't buy her a pair of shorts or pants, and she didn't want to bring this up. So she brought this up in therapy, and we really processed how we could just explain that this is something that was important to her family, and that we needed to find alternative things that she could do in gym class and wearing a skirt. But there was a lot of shame that she had because she wasn't able to be like everybody else. So sometimes you really need to dig deep with some of these issues that arise. So determining what is normal and expected behavior in multicultural families is considered a culture-bound task. So we really need to be careful about indicating what's not normal. A lot of these families, if you don't really know about these families and how they live, many of them live in one mattress, right? They all sleep together, 7 people in a mattress. But when they say that to a teacher, well, I sleep with my sister and my dad and my mom, what do you think happens sometimes? Have any of you encountered this? So, really just, yeah, Elise?
I was just going to say, with mobile, we go to the home and we see that.
Absolutely.
And we know that there's no other option for this family. This is This is how, it is.
Sure.
And it's not that they've chosen to do it.
That's their only option, right? And so I think there's a lot of value that comes with seeing the home, but I think there's this tendency for people who don't necessarily understand, it's just immediate reaction that says, what do you mean? You live, you know, you're sleeping with your parents and your older sister, right? There's this like, you know, especially if there's a major age difference, what's going on here? So really kind of being empathic to that and understanding. So tell me a little bit about your home. Tell me about where you live. What's it like? How many rooms do you have, right? So really kind of engaging the child and family with some of these questions. Good. Did you have a comment, Jill? No. All right, so another cultural consideration is to really explore the function of the behaviors in the family. So what's the cultural norm for the specific group regarding the behavior? This will offer some insight into what the overall impact of one's cultural background has on their development and how this impacts them overall. Any ideas of some of the other questions? I gave some examples, but what are some other questions to really find out about what are the normal behaviors in the family? What are some clinical questions that you could ask a child when you're trying to find out about what's typical? Yeah.
I guess sometimes when they say you have to ask if what do you think about that. Let's say some kids might say I talk to my dead uncles or aunts or grandparents,
Right.
and we may think that it's like hallucinations already, but it's part of their culture. So maybe when sometimes when we're faced with those situations, you can ask them what do you think about that, and then try to navigate around that.
Good.
That's
Good
part
comment.
of the culture.
Absolutely. Jen.
I always try to find out who has the power for decision making, right? So it's like, who do you ask when you want to go play at a friend's house? Who do you ask when you want to go get like a special treat from the store? Just so that way you know who has the money, who has the control in terms of where you go and what you do, just because that person is usually a person that you want to align with.
Sure.
In order to be able to help them.
Absolutely. Good. Anything else? So, oh yeah, Jeff.
I may want to ask, if I'm understanding your question right, I may want to ask, like in a kid's case, I might say, does anybody in your family give you a hard time over such and such? I might use that language.
Okay.
To get a sense of whether this is on anybody else's radar in the family.
Perfect.
Or anybody else
Sure.
for that matter.
Is this considered a problem in the family?
Yeah, do people give you a hard time about this? Are people concerned about this?
Sure. Absolutely. So I love the Dominican Republic. I've been there 6 times, and I love to watch what the natives do. So anybody been to the DR and not just stay in the resort? So what do the kids do? What are the kids, all ages? What do they typically do?
Babies walk around naked.
Walk around naked.
It's like typical.
Are they all kind of, sitting at home in their technology?
Yeah, no, they're playing outside.
They're playing outside, right? Usually without parents, right? So, I walked out of the resort a couple of times and just to one of the little towns, and the kids are all, tiny kids playing in the ocean, playing ball on the beach, completely unattended. Here, if you have a, 8-year-old who doesn't have a parent, what's our immediate reaction? What?
Where are they? Yeah.
Where are the parents? What else? What do we want to do? Call these which is understandable, but for many families, this is typical, right? That the kids at a very young age are out on their own after school, or they're playing at the park, or they're riding their bike, and it's a real adjustment, especially for the kids if they spend all of their summers there. And so they're used to this there, so why would it be different here? I'm done with school, I have nothing else to do. I can go get on my bike and hang out with my friends. What were you going to say,
I was
Trudy?
going to say, just coming from the Jamaican culture, there's that sense of community. So knowing that your children are out there playing amongst one another, you're looking out for the others as well.
Sure.
So it doesn't have to be your child that you're watching.
There's a trust, a level of trust where someone else is out there with them, or there's an older kid in the neighborhood who's going to watch over them. Yeah, absolutely. Any other thoughts on that? Yes.
Just when I was in college, I studied and did research in Samoa and Vanuatu, and the little babies there, they would also run around naked, but they'd also like run around with like machetes and like be using that to like cut coconuts. And so I was one of 7 students, but I was also the only student of color, and so all of my like the people I went with, they flipped out. They wanted to know like where's like child services, and I was just they don't. Samoa, they don't have child services. Like people are watching them. Like they know how to use a machete. That 3-year-old knows how to use a machete better than you would. Like they're okay. Yeah. And so we kind of had to have like an intervention because they could not like they were just freaking out. And I was just like, this is their culture and we're not in America. So just calm down.
Right. I'm glad you were there to settle down. Absolutely. So really there's this immediate desire to be reactive rather than, observe and is this typical behavior? Is anybody else alarmed, right?
No.
And that goes to your question, Jeff, about is anybody else alarmed by this? Is this kind of normal behavior within your family? Great. So just some shifts, you may or may not know this. The DSM-4 just listed the culture-bound syndromes, which I gave you a copy of, so hopefully you have that. The DSM-5, however, I think we're finally catching on to the need for greater cultural sensitivity in our work. And so rather than just listing the culture-bound syndromes, they have listed criteria that reflects cross-cultural variations in presentations. They provide more detailed information about cultural concepts of distress, and they also include a clinical interview tool to facilitate comprehensive person-centered assessment. Have any of you seen that? I want you to take a look at that. So there's a culture-bound syndrome. Anybody need a copy? Anybody have one? Okay. Have you guys seen this? This is one of those things where I use all the time and I wasn't sure if people use this. So I just want to take a moment to look at this. Is a really great tool. It's the Cultural Formulation Interview, CFI. And this comes from the DSM-5, but it really helps to guide some of the questioning when we're working with anyone of a different culture. So it identifies what are some of their stressors, their supports, the role of cultural identity, some of the cultural factors that affect their coping and their help seeking, some of the barriers. It also looks at the clinician and patient relationship. So this is just a really, really great tool that you can use when working with someone of a different culture. And then the other one is a list of some of the culture-bound syndromes. And so one of the ones I just want to focus on that's pretty common to Latinos is the ataque de nervios. Has anybody heard that before? Yeah, what does that mean? How do we translate that? A panic attack, yeah. And so what do you think when somebody's trying to describe that? What are some other things what are some of the assumptions we might make when somebody tells us about that? Jeff?
Well, we might take the literal translation and just assume that the definition is the same.
Okay.
You know what I mean? So like this, and I don't really know much about it, so which is why I say it. So we might say, well, okay, that translates to panic attack, so bam, there we go.
Right.
These are the symptoms, when they may not be the exact same symptoms.
Sure. And a lot of times we'll see that too where people will talk about that when they lose a family member. Because of the closeness of the family system, it's like, they'll explain this to you and you're trying to kind of differentiate that. But there's some really great stuff on here and it'll tell you what the cultural group is. But the other one that I wanted to talk about briefly for Latinos is susto or miedo. And that relates to being very tired or weak, resulting from something frightening or some startling experience. So get any questions on that? How many of you have used this cultural formulation interview before?
I'm using it in class.
Okay. That's surprising. And you know, I actually said to Susie yesterday, I'm like, do you think everybody knows this? Because I mean, this is something that I use a lot, but I'm glad it was helpful. So hopefully you can use that in your work. So some of the treatment considerations, really important to, when possible, and this isn't always possible, but I'd like to believe that we're getting better at this, is to, lean towards using somebody who does speak Spanish versus the language line if possible, because it's a little bit easier referring out to a clinician who speaks Spanish, even if they're fluent in English sometimes. I actually, in my private practice, I see a number of clients who are fluent in English, but want somebody who speaks their language. And sometimes they'll get to a word and they'll say, or they'll start mixing. And they want to be able to do that because when they're thinking about something, sometimes they can't think of the word or they can't explain it to me in English, so they want to have the ability to say it in their native language. So at first it was very surprising. I was like, why are you driving 30 minutes to come here when you speak English? And they're like, oh, it's just easier because you understand the culture, or you can, and sometimes they'll shift back into Spanish or Portuguese, and there's just this different comfort level. So whenever possible, try to find them a therapist who does speak their culture, their native language rather. The other thing is to not use a one-size-fits-all approach. I'd like to think that nobody is doing that, but I just wanted to bring it up. So, we don't need to work with every Latino in the same way. Obviously, they have some similarities, but we need to take an individualized approach while also looking at where they're from, how this relates. Another thing to think about is, are they from a town? Are they from a city? Because that gives you a sense of the kind of resources that they are used to having, or lack thereof, right? So if they lived in Mexico City, they're going to have a lot more resources as opposed to if they lived in Puebla. So really just kind of gathering information about that. Are they resourceful? How do they find you? You really want to capitalize on some of these strengths, and also are they likely to continue treatment? Are there barriers like transportation barriers? Are they still struggling with language? So you really want to look into all of these things. Other treatment considerations. As we talked about, familiarizing yourself with some of these culture-bound syndromes, utilizing the cultural formulation to aid in accurately assessing the impact of one's culture. We talked about that, addressing individual client needs while also incorporating information you've received about a specific minority group. Conceptualizations of culture should not depend on group membership, but rather offer a base for understanding cultural competency. So we've been talking about this throughout. How do they get here? Their story. So really kind of having them paint a picture for you about their story, how they got here, what were some of the challenges. You always want to ask about their trauma history. A lot of these, not just women, the men are encountering sexual abuse throughout their migration process. And so you want to ask about that. You want to find out about what they encountered throughout their experiences. Fear. You also want to ask about fear. Were they incarcerated at one point, during their first attempt at trying to cross the border? Were they incarcerated for several days before they were sent back to their country? Was there a fear that somebody was going to take them somewhere else? Lots of issues around human trafficking. So, find out about all of that. How they identify with their culture, Latino culture versus American culture, and identify their family and social supports. we've talked about all of that. Oh, the other thing I want to just add is threats to hurt their family. Anybody know about this? Anybody familiar with threats to hurt their family during their process to get here? So sometimes in an attempt for them to get more money, they will ask the person who's migrating to, they'll say, you know, we have your cousin or we have your mother, and if you don't give us $5,000, you know, if you don't get us $5,000, because they know they have family in the U.S. who's already paid for them to come here, so they try to threaten them and threaten harm to their family. So it can be very, very scary. Anybody hear about that? No? Just a sample of questions that I found in my research. Does the host culture marginalize the individual? How familiar is the individual with Western cultural norms? How much time has the individual spent in the U.S.? Are there language issues which need to be taken into consideration? How assimilated is the individual to the host culture? How assimilated is the individual to the host culture versus how much they try to avoid the host culture? So this can go either way. I did some research in psychological assessment because I'm specifically interested in assessments for immigration purposes, so I wanted to just include that today, and how much of a lack of assessment tools, I guess, appropriate assessment measures there are for doing a psychological assessment for immigration purposes. So I wanted to talk a little bit about the applicability of some of the tests and how they don't transfer to certain ethnic populations, given that norms and standardizations are mostly based on white European populations. They have used the Rorschach because of its cross-cultural validity. However, that has also been questioned as whether or not that is a good measure. Given the underrepresentation of ethnic sample groups in normative samples, evaluators often have to question the external validity and differential validity when testing ethnic individuals. Anybody here do testing for Latinos? Anybody ever done testing? No? So the MMPI-2, what they found is that it can be useful to interpret these results based on how a person compares to the normative sample. So one of the things they saw was that if they scored high on paranoia, it might be interpreted as indicative of psychopathology. However, based on cultural or situational factors, that high score on that scale may be a result of their fear of deportation or a legitimate distrust of the mainstream culture. They've also done some research on the TAT, the thematic apperception test. These are all projective tests. And have used that. And then they have also really focused a lot on the clinical interview, but they have found very, very little research for utilizing some of these measures in completing a psychological assessment. So some of the takeaways for today. We want to make sure we're familiarizing ourselves with the culture-bound syndromes. We want to acknowledge early on about the barriers, potential barriers to treatment, and identifying whether or not there are ways to counter some of those barriers so that they can continue in treatment. We want to acknowledge all of the cultural factors that come into play, and also use the cultural formulation interview that we talked about. And then we want to consider things such as body language, eye contact, and open-ended questioning, and look at how that might impact your rapport building. So some of the helpful books. There's not a lot out there, but I really like Latino Families and Therapy, and the Counseling and Family Therapy with Latino Populations. That has been a helpful book. And here. Well, thank you all.
Thank you.